Hello and welcome to the Doctor's Corner. I'm your host as always, Dr. Mark Pinsky, and today, just me and my executive producer, Jeremy Gonzalez, behind the scenes in his hazmat suit. For real. Today we're going to talk about coronavirus, which I'm sure you're all very familiar with by now. Maybe even some of you are sick of hearing it by now. But I do think we're going to come at it from a little different perspective, and by the end of the show, I think you'll have a better idea of what you should be concerned about, what you don't really need to be concerned about, why you need to be concerned, and maybe why you don't really need to be as freaked out as everybody seems to be. I do think the press has really accelerated and exacerbated people's anxiety over the virus, and some of it's validated, but some of it I do not believe is so. So what is this virus that everybody's talking about? Well, coronavirus is a type of virus. There are multiple subtypes of the virus. It's not new, except that this is a different strain than we've seen in the past. Back in 2003, there was a virus called SARS, right, which is a severe acute respiratory syndrome. And that took 8,000 people, as a matter of fact. That killed 8,000 people here in the United States. And then there was another virus that came along in 2012 of the same family called MERS, Middle Eastern Respiratory. And some of that has made its way and migrated, although less severe, over to the United States. So why are we so concerned about this particular strain of virus? Well, we're concerned because of how quickly this spread has taken place and how quickly people seem to get sick. Now, if you look at the data is actually pretty clear, although changing. And so we're going to do some Facebook Live updates so people can have a better idea of what's happening and where we are and what updates have been and what progress has been made in terms of treating the actual virus. But as of now, the concern again is this rapid spread. I think the good news is that 80 to 90% of the people seem to do very well. They're either asymptomatic, don't even know that they have it, or they actually do very well and have mild symptoms. Now, what's happening is you're starting to hear about some of the more severe cases, and we're going to talk about who's most susceptible to develop those. Just today, as a matter of fact, the Surgeon General released that some of the younger people that are getting it are of the age of vaping. And I do think that that's a very profound statement that we never really understood what would come of vaping. I did a show a couple of years ago regarding vaping, and I said then it would be really bad, that vaping would be really bad for teenagers and for anybody that was doing it. But I was anticipating it more from a cancer standpoint or from a respiratory in terms of COPD, obstructive lung disease standpoint. I did not even anticipate that it would make people more susceptible to upper respiratory diseases. But it does appear that the younger people, a large percentage of the younger people that are getting it, have either been exposed to vaping or have done an extensive amount of vaping. So I thought that was interesting. That literally just came out this morning. So how has the virus spread? Well, the virus itself has really spread person to person most of the time. Now, that's usually done via respiratory droplets. That's why this social distancing that everybody's talking about, 6 feet, will hopefully prevent that person-to-person spread. I think the bigger fear is how long the virus lasts on surfaces. Just to give you an example, HIV or the AIDS virus doesn't last very long on surfaces. We're talking seconds. It's really there and gone. So that was never a concern with that particular virus. This virus can last on surface tops. They're talking about days or even weeks. Again, the exact numbers are not known. What we do know is that it does last on doorknobs and it does last on other surfaces where people touch frequently. So we're telling people to be very cautious when they do those things. All right, let's kind of move on. What are some of the symptoms of the virus? We've heard a little bit about that. Coughing, for sure, is a large issue. What separates that from, let's say, allergies, right? Well, people who cough, normally there's other symptoms involved, right? So they get nasal congestion, they have itchy eyes or itchy nose. So you usually can tell those differences apart from one another. But this virus also appears with usually a high fever. Not always. I mean, again, some people are asymptomatic, but coughing, fever, and shortness of breath, which is extreme. You don't normally just get a little bit of shortness of breath. It's pretty severe, the shortness of breath. Again, I think those are the more severe cases, and in those cases, I think we're pretty well aware of now, and they're been highlighted. I would say that some of the other subtler symptoms, such as sore throat and muscle aches, are very similar to what we see when somebody develops the flu, for example, which is just a different type of virus. Now, one can make the argument that, well, how do I know it's the flu, or how do I know it's this new virus? Well, you don't really. So the question has always been, well, what do you do in those scenarios? If I'm one of those people who develops those symptoms, what should I do? It's a tough question, and patients ask the question of our office all the time. And I think if your fever is low and you're really very asymptomatic, you have to isolate yourself, and you have to isolate and quarantine yourself. So how long do you do that? Well, we know that this virus, the incubation period for the virus is usually about 2 weeks. And so that's why they're telling people to stay isolated or quarantined. If you've been involved or been in contact with somebody you know that has the actual virus, you have to quarantine yourself for 2 weeks. That will hopefully prevent the spread. And so some of these simple things that we're talking about really will help what we call flatten the curve. What are we trying to do by flattening the curve? We're trying to decrease the transmission one person to the other person. And that actual curve itself will flatten out over time. And if we get that flattening out, then we know that the virus is under control. And that's basically what the Surgeon General, the CDC, the World Health Organization are all working on, trying to create an environment where we're halting the spread so we can flatten out this curve and resume our normal lives. So who's at high risk for developing the virus? That's always a logical question. Well, we said our seniors for sure, anybody over the age of 65, particularly anybody over the age of 80, this virus seems to have a profound rate of attack against. People who live in quarters such as nursing homes or long-term facilities, and those are just normal centers for disease anyway. I also think that the problem is those patients have what we call concomitant disease. They have a lot of different disease states, and so from an immune system standpoint, it gets taxed and overwhelmed, and your body's trying to heal you from your chronic disease, and then cannot really handle any other attacks that come about it. Lung disease is an obvious player here. Even people who have asthma, which is why I think you see some of the younger people getting attacked by this. If you look at the number of patients that are younger that are being attacked by the virus, they seem to have some type of underlying problem. Certainly not all, but a good percentage of them do have some underlying lung type of disorder like asthma. Again, your older patients who are your smokers or who have smoked a lot in the past, or have developed unfortunate lung cancer, those people are very susceptible, or is anybody who has any type of autoimmune disease or is being treated with immunosuppressive therapy, such as prednisone or chemotherapy or even radiation therapy. Believe it or not, even those patients who are obese, morbidly obese, greater than a BMI of 40, and on top of that, they also have disease such as hypertensive heart disease, or they have developed diabetes, those types of diseases, renal disease, liver disease, those diseases also, again, because your body is trying to do everything it can to create what we've talked about many times in the past of homeostasis, the body's balance, that other overwhelming events tend to slip in. Okay, so as of now, really, what's the priority? How do we prevent the spreading besides the social distancing that I talked about? Well, I think one of the easiest things to do is wash your hands. I mean, some of these things are just common sense, right? We should have been doing them all along, but for some reason we're not. Unfortunately, my recent travels were cut short by the virus, and on my way home, I noticed it was amazing how clean the airport was, how clean the plane was. I just couldn't believe it. I had never seen that before, which just proves we could do it if we really wanted to do it. Just cleanliness, being next to godliness is real. And cleaning your hands, washing your hands appropriately, learning how to wash your hands. It should be at least a 20-second wash, not just the palms of your hands, but you should cover in between, and all the entire surfaces should be covered. And as important as the washing is really the drying. You must really make sure that the fingers and all of your hand are totally dry, and then dispose of whatever you're using, paper towel or what have you. Hand sanitizer, as you know, has flown off the shelves and almost impossible to come by, but that does work and is something that's incredibly helpful. Common courtesy: cover your nose if you sneeze. Use a tissue. If you're going to cough and you don't have access to anything, covering your mouth or covering it in an appropriate way so that you're not exposing other people to those droplets. One of the things that Jeremy and I talked about is, the wearing of the face mask. Of course, just a generalized face mask is not nearly as good as what they're calling the N95 face mask, which does better, but the N95 face mask in it by itself doesn't work as well. But if you put a regular mask over the N95 mask, that actually does better. The question is does a person who has no symptoms, does a person who doesn't think he's been infected, does that do anything? Of course, according to the CDC, the World Health Organization, it does not. But I think it's because of the way it's handled that it doesn't work. So in other words, people are touching their mouth, people are touching their nose, people are touching their eyes, and they don't wear the mask correctly. The nose has to be totally covered. I watch people wearing the mask below their nose, which is pointless. And I watch people touching the mask all the time. You can't touch the mask at all. And if you're going to adjust the nose, you just have to adjust the nose piece. When you take it off, you also cannot touch the face mask. You have to just kind of remove it and dispose of it without making contact. I think those things would make a big difference. And if it does make you feel better, it's not going to hurt you to wear the mask. And certainly I do it to protect other patients who might be immunocompromised that I'm seeing in the office from developing perhaps another further. I may have been exposed and am asymptomatic and don't even know it. Okay. So self-quarantining, we did talk a little about isolation. We talked about flattening of the curve. What else can we talk about, Jeremy?
So is there anything people can do as far as vitamins and self-care?
Okay. So I think that's a great point. I think that what happens is your overall well-being and your overall health plays a big role. This isolation is making people a little crazy. You should have no excuse now not to get the proper amount of sleep. There is no substitute for the appropriate amount of sleep. It will boost your immune system. It will help you fight off infection. Eating properly. People are going to gain a ton of weight during this period of time because they're just sitting around. And I've used this as an opportunity. I had actually had a little bit of a vacation, as Jeremy knows, and I used this staycation as a time for me to crank it up and do 2-a-days in terms of my workout routines. And I do think that does help to boost your immune system. It builds your B cells, it builds your T cells, which help fight off, short-term but also long-term infections. As far as vitamins go, I think that even the best of us who really are cognizant of how we eat don't do a very good job because the food supply in our country is not what I would deem adequate. I would supplement in between. I do think that doing good supplementation is super important. One of the ways to do that is to take a health assessment. I'm working with a company now called ID Life that allows you to do a health assessment so we can figure out what vitamins you really do need. You can actually go to take that assessment at Dr. Pinsky, small letters, DRPINSKY, .idlife.com. If you don't want to do that and you just want to take an overall multivitamin, better to do that than to do nothing. And again, making sure that you're taking in the appropriate amount of fruits, vegetables, stay away from all the fried fatty stuff as I've asked people to do in the past. I think that, above everything, will probably help you, fight off the infection. Anything else? All right. So what I'm going to do periodically throughout the next couple of weeks is I will appear more likely on Facebook Live, and I hope that you will join us there. If you have any questions for us, we'd like your questions at drmarkscorner@gmail.com, or you can actually visit me on my website, pinskywellness.com. And you can ask me questions there as well. And one of the things we'd like you to do is check on the YouTube, click on pinskywellness.com and share. And we have all of our previous videos on there. So we'd love you to view those too and share those with your friends. And until next week, I am Dr. Mark Pinsky. You've been watching The Doctor's Corner. This is Dr. Mark Pinsky once again, asking you to forward questions to us, whether regarding this episode or any of our past episodes, at drmarkscorner@gmail.com. Also, don't forget to check us out on our website, pinskywellness.com or pinskyweightloss.com. We look forward to hearing all of your questions, and we'll get back to you as soon as we do. Y'all have a great week.